Dr. Pradhuman, can you check and see if the sound is there on YouTube?
Ma'am, sound is there, no problem.
It's there, no?
Yeah.
Okay, thank you.
Welcome.
Sorry. Hello and welcome everyone. It is to the second season of the Oral Pathology India's webinars on Oral Pathology Tuesdays and brought to you through the Oral Pathology 360 channel. And yes, that's a lot of oral pathology. But well, that is what we are trying to do, bringing oral pathology back in the fold with everything else and promoting it at the same time. Now, considering it's a second season, I don't know how you feel about starting second seasons of your favorite show. I always feel a sense of excitement, just hoping and anticipating that there is enough new stuff. And at the same time, there is also familiar enough. Things haven't changed so much that you're, in a completely new setup. Well, we have tried and seen that it stays interesting, and well, you will love it because it's oral pathology. What's there not to love, right? So it's always going to be fun. And well, I'm glad you're here with us and joined us for the next season. And with that, let's move on. Yes, today's episode. And we started the last season also in the beginning. I think it was almost the third video was on forensic odontology or forensic dentistry. It was all about the career horizon. What would you do? What would you expect? How you'd go about becoming a forensic dentist. Now, this time we are delving a little deeper. We are going on with some techniques, some know-how, some research gaps, and of course, wherever there is a gap, there is opportunity. So for that, we have the teeth tell. It's an interesting title that basically tells a lot of its own facts, a lot of a tale of its own. And it's by the very innovative and interesting Dr. Aman Chowdhry, who interestingly I did not even know until a month and a few days back, I think. And ever since then, this is the third program we have been together in. So that itself tells you he's a very, very interesting person, because I'm always out scouting for new talent. And I seem to have not only seem to, but definitely I've found one on him. We also have with us Dr. Pradhuman Verma. He is going to be moderating the session. He is working as the chairman, Department of Oral Medicine and Radiology, and Oral Pathology and Microbiology in the Dr. Ziauddin Ahmad Dental College and Hospital, Aligarh Muslim University. He is a oral medicine and radiology specialist, also has a postgraduate diploma in forensic sciences and the Fellowship of Forensic Odontology from Indian Board of Forensic Odontology. He's a recipient of the 2019 Fellowship Award from the Indian Society of Dental Research, a life member of many professional bodies, and also a highly published author, speaker, and the editor-in-chief of JINPAFO. Maybe he can tell us what that is. Okay, and with that, I'm going to just ask Dr. Pradhuman to take over. Hello and welcome both of you to the show, and Dr. Pradhuman, please take over.
Thank you so much. Thank you so much, Dr. Manna, for giving me the opportunity to moderate this show, today's show. So good morning to one and all. So today we are in the show, we are having Dr. Aman Chowdhry with us. So Dr. Aman Chowdhry is a professor in the Department of Oral Pathology, Faculty of Dentistry in Jamia Millia Islamia University, New Delhi. He has been actively involved in the academics and research since 2004 after the completion of his post-graduation from the Pune. Dr. Chaudhary has completed his postgraduate diploma in hospital management from the National Institute of Family Welfare and Health, New Delhi, and is a fellow of Indian Board of Forensic Odontology. He has been trained in the 3D and 4D forensic reconstruction at the Central Forensic Science Lab, Chandigarh, and the 3D computerized forensic reconstruction from the University in Germany. He is a founder, secretary of Indian Association of Craniofacial Identification, and acting as a secretary general of Indo-Pacific Academy of Forensic Odontology. He authored and co-authored many papers in the peer-reviewed international and national journals. He traveled around the globe for his academic ventures and passion for interdisciplinary approach towards the forensic sciences. So today he'll be discussing about the teaching of the forensic odontology among the dental graduates and postgraduates, both the theoretical and the practical aspect of the subject. So the dais is now your Dr. Aman. So Dr. Aman, you can start with the lecture.
I hope I am audible to everyone.
Yes.
Okay. Before I start, I would, though I'll be saying thank you to the 360 oral pathology also. But before I start, what will it all be about? It will be totally my journey. Everybody has his own. You can modify as per your convenience, as per your resources, as per your history, as per your future. So this will be all which I'll be talking. It will not be rocket science. It will not be lot of Sherlock Holmes. It will not be what is hyped up in your mind. So let's explore what I want to talk about, what I'm so passionate about since so many years. Okay, screen is visible?
Yeah, Dr. Aman, screen is visible.
First of all, what is it going to be? I have told you that it's going to be my journey. You can modify as per your own convenience, as per your own. So what is it? What is it I'm going to be talking? It will be how teeth tell tales. And before that, I would like to thank the channel. I would like to thank Dr. Mandana. I would like to thank Dr. Pradhuman for introducing me so well and giving me a platform to share what I have been doing for maybe 5-7 years now. So what will be the workflow today? Workflow will be forensic odontology, an overview, what exactly happens here in the subject, just to introduce you, because I see a lot of undergraduates even tuning into the channel. Then you have first-hand practical experience. That is my experience, what went through, how I went inside the subject, and how I could explore it, and then road ahead. That will be what I see my future, what I see the future of the subject, and what all scope of employment, etc. Though it has been discussed at various platforms, this will be totally it can vary as per the cases. So an overview. What is forensic odontology? Let me serve you very hot. What exactly, in a very concise manner. The word forensic itself comes from the Latin word forensis, meaning that the forum. It originally applied to the marketplace areas with ancient Rome, where many types of businessmen and public affairs used to happen, such as government debates, action of court laws. So that's how the word originated. Forensic odontology is application of dental sciences to the administration of law, furtherance of justice. So if a general student asks me a casual definition, it will be application of oral and para-oral knowledge for civil and criminal matters. That's the easiest thing I can think of as a definition. What all can he do? Why teeth? Why so much talk about teeth? What is so important about teeth? There are few things should be clear to you. First of all, you might feel degraded. We have DNA. You might feel very disheartened. There are much more accurate carbon dating. Why should we go for a teeth then? We can easily get a DNA test. And why the hell we're going for? We have such advanced techniques. Why do we need such simple looking at a teeth and telling the sex or telling the age? Why do you require that? Why do you want to see why, when you can do for a DNA, why to do a bite mark analysis? Why not do a saliva analysis and just tell it that what exactly happened? So each tooth has an individual set, how it is. That's how we have been learning in for 15 years, 12 years in DADH, that the tooth have traits, they have type traits, they have various kind of traits which we learn about and we talk in dental anatomy. Now is the time to apply it in forensic sciences. Teeth are made up of enamel, the hardest tissue. It can withstand trauma. It can withstand a lot of temperature. So they escape a lot of decomposition.
Dr. Aman, we have lost you. Dr. Aman?
I think there is some network error with Dr. Aman.
Yeah, there is.
Yeah.
I'm sure. Yeah, I'm sure he'll be trying to join back soon. He seems to be having some problem. I'll just say who all are here. We have some regulars back on the channel watching us, like Dr. Varun Rastogi. Hi, Varun. Well, lovely to have you back. Dr. Priya Dio, Dr. Usman Guevara from Ecuador. Yes, from the middle of the world. And Dr. Pooja Chakravarti, and we also have Dr. Priyanka Kapoor. Hi, Priyanka. And Dr. Deepika Bablani, Dr. Meher Angiz, Dr. Nandini, of course. Hi. And Dr. Sneha, Dr. Sonal, Dr. Parinita. Yeah. Hi, hello, and welcome, all of you. And we are having a minute, small technical glitch. We should have Dr. Aman back shortly. And in the meanwhile, I think I will let Dr. Pradhuman tell us what made him do so much. I mean, he is the oral medicine in this, but he also has done a lot clearly in forensic dentistry. Okay, I think Dr. Aman is back. Aman, are you back? Aman?
I think Dr. Aman is facing the problem of network
Yes.
problem.
Yeah.
I'm there.
Yeah.
You're there. Aman, what I would suggest is turn off your video and only keep the lecture running.
All right, I'll do that.
Yeah, that might help.
But the thing did not happen because of the drop in the signal. It happened because all of a sudden it flickered and it collapsed. I don't know.
Okay, fine. Then right now it's okay. Then just continue. Okay. We're going to hear from you, Dr. Pradhuman, later. But okay.
Yeah, sure,
cool.
ma'am.
Yeah. Okay.
Are
we seeing it?
Yeah, slides are visible.
DNA, dental as well as fingerprints. That is a comparison, and you can see the tissue durability of dental in hard tissues, how it withstands decomposition, heat, trauma is enormous. It is very important to understand that. Now, everybody sees same thing in a different perspective. And I want everybody who is tuned in with his experience. I have maybe 10, 15 years in dental anatomy, oral pathology. Somebody might be having 25. Somebody might be 3 years. Somebody might be on oral medicine. Somebody might be oral surgery. You see the same thing. In all things of nature, there is something marvelous. Just add to it that you have to find your own marvelous thing. And how you find it is going to be important, that you become passionate and you should have knowledge about that. And that's exactly what you have to do. So if you see this, can you establish the identity? Yes, you can see world's most powerful man as on paper on your right, whether it is Obama, whether it is I shouldn't be naming, but then if you are given this, are you able to establish identity? Not at all. How about this? No. And how about this now? Are you able to establish identity? Not at all. You will not be able to. So it is important that you are trained to actually tell what exactly is going on. Who is it? Establish identity. And establishing identity is one of the most important objectives of a forensic odontologist. He has to tell who is who, whether it is DVI, whether it is crime scene, whether it is civil litigations, criminal litigations, all have to undergo identity. So identity is very important, and teeth do tell tales. They do tell what exactly the person is, what exactly is. Nowadays there is paleodontology, which is there. You can tell even the dietitian, dietary habits. You can tell a lot of things out of just by. So how do you establish ID form? Dental identification is either comparative or it is reconstruction. Once you are not having an identity, what you do is you have the comparative identification as well as the reconstructive. Now, comparative identification is when you compare it with the when you have antemortem records available. Then you compare it with postmortem. Once you are not having it, then you have to build it. You have to do dental profiling. You have to narrow down the search of an individual. You have to do a lot of things which exactly might establish his, or you might be able to give name to the body, which is very important. You have to give a name because you have to close the case. You have to give the correct body to the correct people, because that will be very important here. We are very emotional people. Here, burying and burning a body is itself also a very important issue. It is very important to give the right of the dead. So that's what happens here. These are two forms which are there: modified interpol, postmortem and antemortem forms. You have to fill, and once they match, that means the body is correct. So once the yellow matches with the red, you are sure that the body is correct. That's how easy it is. So you have a positive, possible, insufficient, and exclusion. So what do you do with when you want to reconstruct? I'll just talk a little about it. What exactly goes on here? So you can establish ethnicity by you have been learning about shoveling, you have been learning about cusp of caribli, you have been learning about double shoveling. These are the crown traits which are there, on which are very prevalent in certain ethnicities. There are various ethnicities. Just crudely to mention, we itself in India are so heterogeneous. The North Indians will not look like South Indian. No, I'm not talking here about racism, but that's how things are. We look a little different. That's how you identify at times that, he might be a South Indian, he might be a East Indian, West Indian, whatever. So that's how we have been. Even every 40 kilometers, our dietary habits change. Our dietary, our speech changes. It's a multi-diverse country where so many climates are there. So you have Himalayas, you have plains, you have coastal areas. Everything we have. So such leads to a lot of heterogeneity. So there is very important to establish ethnicity of an individual. Then deriving, you have something called as ASUDS caste, that is Arizona State Dental University caste system. Beyond the scope of this lecture, but then I'm just highlighting a gap that any population can be tested on that to know the ethnicity of the individual. So this might be very handy when you are establishing an identity of an individual through teeth. Deriving age. Now, deriving age from teeth is very important and has been discussed. A lot of research has been done in it. It is in prenatal, in age estimation of children, in age estimation of adults, in biochemical indicators. Now, these are very, very casually used words by people who are not understanding. But for people who are going in depth, these will lead to a lot of things like various methods like Demerjian, Williams, Gustafson. Now these people have elaborately discussed, and they have done a lot of research work in these topics, and you can explore the same in your own population where you are living, or maybe you can define a study like that your population can be discussed over with a certain. Now there are atlas methods also available. What you do in your first year is somewhat like a Shaw's and Mosler, where you can compare it with the X-rays, or you can compare it with the cast which is there. But that is a atlas method which is there. So you have something called as London Atlas also by Al-Khatani. Now this is also being explored. Then there is Darling's method. Now it might appear a little cliché, but that is exactly the name of the atlas which is there. So you have, every branch has so much to contribute in this. Whether you can see it with, as I said, you can see it with your own lens, what exactly you want to contribute to. Whether you're an oral medicine expert, so many of records you have, you can utilize them. Whether you are an orthodontist, you will see in the later part, my team has a very important aspect of orthodontia in contribution. Then you have oral surgeons, you have prosthodontists, which can contribute a lot. Everybody has his own. So there is the domains which we can touch through is age estimation, sex determination, ethnicity determination, bite mark analysis, mass disaster identification, Cheiloscopy, Rugoscopy, methods of identification, child abuse, neglect, dental jurisprudence, forensic facial approximation. So much to really explore, and so much to really contribute from your own lens, which you see through. And it's up to you how you look at it. The horizon is totally open if it appeals you. Little bit about bite mark investigation. Now, bite mark investigation, you need to be really equipped. I suggest give it to the best. There are very few people train in India who are really equipped with it. Give it to them. They are equipped till the time you are equipped to it. Do not explore it. Don't make it look like a junk science as it used to be. Just don't be over ambitious in that. Do not try to be Sherlock Holmes on the day one. A tooth mark, arch mark, bite mark, pattern, whether it is a human bite mark itself will solve a lot of things. You should know peculiarities. You should know where it is. It should match with the story, where the bite mark was found, how to take a picture. Picture is very important. Now, this is not a human bite mark taken. This is human bite mark. Now, but this is not how you take a picture of a bite mark. See, many of you might be posted somewhere, and all of a sudden you have assault coming, and you need to know how to go about taking a picture. Picture is taken in two go. You have two pictures taken. One is with the ABFO scale, that is the scale which is there, which you can see, American Board of Forensic Odontology scale number 2. And this is the orientation picture. The whole anatomical site is seen. This is the anatomical gross picture where you can locate where the bite mark was. And the other one is the bite mark actual, where you keep the circles which are there are used for cutting through the distortion which happens. What exactly is going on here is that you play with the picture and then you superimpose it. Now this is how it is done. The first picture is the original one, and I have changed it to New York, to Taj Mahal, to anything. So nowadays you are better equipped than me. So if you explore, you will understand that creating onlays and just keeping on it will actually decide the bite mark analysis. I've used the same thing. This is one of the cases where I used this technique where the cutting through was done, and then it was sent to an orthodontist for an opinion, and then a lot of science was taken care of, whether it is male, female, what are the sizes, what might be the occlusion, etc. This is one of the cases there. So how I got involved? I got involved because I was teaching since for 5-10 years, and then I realized that the art which I have might be used in something like forensic odontology. And then there was a workshop which happened in my university, and from that I never looked back. I was totally involved in forensic facial approximation, that is utilizing of your artistic skills in building up of faces on the framework of the bones. So art and science will play a very important role here. I used to do just caricatures, faces I used to draw, and that's led to forensic facial approximation. That is the other way is many contemporary people call it forensic facial reconstruction. So that's what my training happened, from forensic odontology to forensic facial approximation. So it is 2D as well as 3D. There are various methods which are there. The method is manual, computerized. I've tried to enumerate few of them which are computerized. I did one of them, the last one which you're seeing, haptic feedback, or a free-form modeling, which I did in Tubingen, Germany. I'll be telling you during the discussion where I tell you what exactly I do, because I'll be highlighting what I have done, the research I have done, the publications which happened, and then where all I have traveled for training myself. So ZBrush or Blender or etc., which are given here, are to be used, but haptic feedback has a very peculiar thing. I'll show you the pictures also. But talking about the easier ones which are there, that is Resimov, that is claimed to be 100% results, is the Russian method. Very difficult to conquer, but yes, people have done it. I've seen myself people deriving beautiful results manually on it. The mentor which I worked under, Dr. Ozgur Bulut, is excellent in it. He has workshops in Germany, as well as he's trained in Turkey police. Lot of work they do, artistic work, as well as a lot of technology they use to really rebuild a face from the skull or the underlying bones. That most of the time mandible is missing. If you see, the mandible has to be derived from the skull proportions. Very important, because you have to derive that also. Then is the second method, which is the American method, the Gatliff technique. Now this is using the build-up which is there, the tissue depth markers which are there, it uses. And then is the mixed technique which is there. Very important to understand that these are all nowadays which is used is a blend of everything. We enjoy all the words of Russia to America. What happens here is that you have something called as the midline marks which are there for your own ethnicity. Like India, you can they can be CT based finding of the depth thickness, or they can be OPG based, they can be lateral ceph based. I think the lateral ceph will give the midline points and the very easily on that. So though errors will be there, but the CT is the CT MRI. There is one study by Dr. Sanjeev. I was trained under him in Central Forensic Laboratory, Chandigarh. Now this, he and his wife, Dr. Daisy Sani, has an excellent article. I don't think so it can be attempted again because there will be a lot of ethical issues. I don't know. That's a very beautiful article, the gold standard article for deriving the midline data as well as the bilateral data for the tissue depth markers. Now, tissue depth markers are put like pellets, and then you start building on it. You should know the skill of developing nose, how it will point, how the eyes will look like, what will be the size, how the ears will look like, how much lip support, how much teeth support, how much thickness to be added, what male features, what are female features, what are the age wrinklings, what are the furrows. You will be amazed the things which you learned in first year, the canine eminence, the mental foramen. Now they will become active. They will become real life, because you were learning it on a dead skull. You will add life to it now, and you will add a name to it maybe later on. You will add a lot of emotions to it. So very important to understand. So talking about this, the midline data, you have now the bilateral data. This is one side I'm showing. So you have 11 points here, and the woman which I'm talking about, the book which is down below. If you see the Karen Taylor, it's an excellent book. She does courses in US. She's an artist employed by FBI, and her skills have been used for right from by FBI to Hollywood. Everything. She has such hands that they turn lifeless to life. And there is one more lady. So the ladies are dominating in the field of one of the fields of forensic facial approximation. That is this is Karen Taylor, and that is C. Wilkinson. Now these two women are very important, playing a very important role in forensic facial approximation. I proposed that a dentist should be a very much part of, and we got it published also, that dentist should be a very important part of a forensic facial approximation team. Why? Because when I was being trained abroad as well as in India, they were teaching how to mix a dental plaster, how to manipulate stone, what is a CBCT, what is a data. Now these things, even a first year person is taught how to manipulate dental material. They might be rocket science for them, but then for us, it's bread and butter. So we should be involved. We can tell age. A first year person is just by seeing a cast, last tooth erupted, can tell it is a 6-year-old, it is a 7-year-old, it is 11-year-old. By just seeing a photograph of an ugly duckling stage, he will tell you what is the age. It might be very, very, very big deal for a person who's not trained in dentistry. So I feel, if you're asking us, why not involve us? That's what was proposed, and I presented that paper in first. The preliminary report was presented in Belgium, and then I got it published as well. So that was a little about manual thing. Now, very, very important to have a digital thing, because you want the hairstyles to change. Once you have a manual thing, you can't go about changing wigs. You can't go about adding from black to brown, changing the eye color. These are very, very difficult job when you are doing it manually, though it is more accurate. But then doing it digitally will be very, very, very easy to manipulate later on, or maybe easy to print nowadays. This is what happened in Tubingen, where I was trained. This is the right side, which you see, the instrument which you see in my hand is tucked back. It has usually in all the blender as well as the Z brush which we talk about, they build up on the skull, and you are able to touch the way you are. But here you are able to touch back. The computer has you go down, you can actually, with this pen, you can touch the skull and you can build on it. There is a button which you press, there'll be skin there'll be material added, and then you can go on adding. There are various parameters how you add it, and then you can see right side on the pellets. First we arrange the pellets, as we do manually, and then we add a lot of fascias, lot of anatomical material on it. And that's what is done manually also. But this is another world. This is another level which is there. Now, this happens very few places on the globe. We are yet to acquire it, but then do it manually, do it with the easier softwares. These are very easy software. I'll not say much easier. When I say they are easier to procure, ZBrush is, I think, freely available. Blender is freely available. Blender is freely available, surely. So you can go about practicing and then go. Don't go directly jump to 3D. You should be equipped. You'll be wasting a lot of money otherwise. Just go step by step. Take baby steps in this. Then only explore this world. This is very fascinating, but then it's very expensive as well. So support yourself only when you are when it is required. Don't jump into it. 3D scanning being used so very often nowadays for dental scans, for implants. You can use it for hair also. There are various types of them. There is something called as a spider, which is used in forensic facial approximation. You can scan through, and then you can. These are the various softwares what are freely available. When you go through the video, you can pause and see what exactly me and one of my students has compiled it. Now, first-hand experience, practical experience, what exactly I have done. This is a little brief introduction of forensic odontology as well as forensic facial approximation. Now, what I am talking is more towards first-hand experience for what is how to go about obtaining skills. My journey was, what happened was, I obtained skills, taught the undergraduates, published scientific research, disseminated knowledge by means of workshops, CDs, oral presentations. Then I got recognition, of course, that's what you work for. And then is translation of research, that is application in civil and criminal matters, what exactly you did. This is my training program. My team is on the left, starting from Dr. Jasuja, Dr. Priyanka, Dr. Deepika, and that's myself. We work together in for solving the gaps which are created when we explore. Down there is my mentor, another mentor. So these all can be that, right from Dr. Ashit, Dr. Jasuja, Dr. Sanjeev, Dr. Osgur Bulut, right from Dharwad to Tubingen. That has been my journey. Lot of steps were there, from Belgium to Indonesia to Malaysia. Now these all were there, but then I'll call them more of there was one more, that is Croatia, that is Zagreb. Now these all might be stepping stones, but these are actually changed my vision towards thing, because they're, whether we like it or not, they were technologically advanced in their feature, in their things, because they dissolve the boundaries. They were not saying that I am a expert in a surgery, or I'm expert in histopathology, or I'm expert in, because they intermingled, and then they got excellent results. So I through this platform, I will say that, you know, let's all develop together. Let's work together, and involve as many branches as we can, so that we get excellent science and people have faith in the judiciary as well as the science as well as our subjects. That should be promoted. This is Croatia. That's Dr. Marine. That is Dr. Hazuvik. And why have I added these two? This is because forensic has a lot of photography involved in it. This is just outside the Zagreb University, Zagreb Dental College, which is dental school, which is there. This is the metal. This is the tooth which you see is made out of metal, and it withstands each. It is just to portray how good we are in metallurgy and use our skills of material sciences. Now on the right, which you see is a bokeh effect. Bokeh effect is done with a camera when you zoom in totally, and the blurring takes place. You must have seen in a matrimonial photography when the bride is centric, and then the outside everything is really blurred off. That is how you might be feeling that it is done with a software. No, you can do it with the lens, with a long bazooka lens which is there. You can do that. Teaching the undergraduates, yes, we teach frontometrics, rugoscopy, cheiloscopy. In my university, this chart was developed. This is developed by Vanshika Jain and Dr. Priyanka, which was developed. And then one of my studies also with this group, which does on DAECC, that is Demerjian comprehensive chart of age estimation. You can go about exploring that. It's available, and search for it. We can help you out if you are interested in research on that. Now, what happened was, since I am into multidisciplinary, I involved so many doctors, and we got a book, major contributions again from from forensic sciences as well as orthodontics in this. You will see a lot of chapters, a lot of work happening here. Compilation happened in a long time. You can explore this book also. Now, talking about publications, to highlight what gaps were there. Now, this is one of the thing which was done again on the tasks which were there, establishing identity through palatal rugae to establish whether they are stable or not. Then this is image manipulation we worked upon. This is when we work on image, how fraudulent they can be in dental records. So playing with, we can add meta analysis, the meta analysis, which is the meta metadata, which is there with the picture, which is very important when you see the properties. It is very important you see that. Then comparative analysis of lip prints, sex determination, routine ones. Then I proposed a Rugoscopy classification, which we might automate now, since we own it, so we can. My team might automate it as well. Now, this is my personal experience. I went to Dharwad to get. I got it published, that so that people get an experience how it is done now. IBFO is done in Maulana Azad. It has shifted from Dharwad. So you can go about exploring that also. If you are going to be trained in forensic odontology, you should. I suggest that might be the stepping stone. Then you can go abroad. You can have various courses, week courses, month courses, year courses, MSc, etc. Then this is about forensic inclusion of forensic odontologists in the team. This we got published. Then is DAECC chart, which I discussed, that that is a comprehensive Demerjian chart, where the entire chart was using so many formulas, so many tables. So Dr. Priyanka and Dr. Now she's a doctor. She did it in second year. Vanshika Jain. They collaborated, and they had a beautiful chart which was there, and then study was done. Then we are into evidence-based. You will see Dr. Priyanka coming very soon on the channel, and in the research section of Dr. Mandana's channel, that she'll be talking about evidence-based. So we did evidence-based in salivary profiling as well, the forensic profiling. So this is one of the publications happened. Then we did it. I joined and worked with one of the TMU. They were working on ultraviolet spectrometer, where they worked upon and detection of saliva, dried saliva. So this is the Belgium poster. This is the workshop which we do on Rugoscopy. This is the Demerjian chart. This is the workshop which we do on forensic facial approximation. We have done at various sites, whether it is lecturing, whether it is workshop, whether it is age estimation, whether it is Rugoscopy, then we have been traveling Indonesia, Malaysia. I can go on. My journey has been various part of globe, and I've thoroughly enjoyed it, because it was tourism along with some reason. These are the workshops which happen right in the center. You see my guide. There is my team. Then this happened in Ames. These are the CD programs at various sites which we did. Now these are webinars. One of them is going on right now. I've purposely put it because I tend to forget. There are I miss the brochure somehow, so I tend to keep it. Then various recognitions which happened. Um, um, we have been doing it, and then when you are doing it, when the crime is involved, or maybe the teaching is involved, you get recognition by being published in the newspapers as well as. So what is the road ahead? As I said, you can have your own journey, but of course there'll be vacancies which are coming now. Even the Red Cross, recently there was in Maulana Azad, there was a, and then I could find in Gujarat Forensic Science, in Mysore, in so many places there are vacancies which are coming up. So even the disaster victim identification will be a new thing. The places where you can give your opinion will be very important. You cannot say that I was not equipped when an age is asked, and you cannot say it with a single single method that you tell that this is the correct one. The emerging is the gold standard. You have to see at least 4 or 5 methods to tell the exact. Then bite mark analysis a little bit. You know that it has been used in various cases. One of them being Nirbhaya. Then there was forensic facial approximation done for Sheena Bora. There was even if you talk about logics, you know about Virappan, you know about Rajiv Gandhi, you know about these all were crime scene building was done. A lot of forensic science was involved. If you talk about Virappan, he was identified by this ear setup. The gentleman who identified is no more. He was an excellent person. Search him. And why am I highlighting? So that I take you to the book. I take you to Google, not to search for easiest shortcuts, but to search for people who found their own way, not with shortcuts, but by applying sheer logics and their science, which they were equipped with during years. So I suggest look at the subject from your own training and derive your own goals, derive your own horizons to achieve. That was the reason I was so eager to talk on this channel, because that myopic at times I see that disheartens, that what are you doing here and what are you doing there. We are supposed to be omnipresent nowadays. So with this, the dais is open. I request Dr. Manna and Dr. Pradhuman to come over and let's have a discussion.
Yes, thank you, Dr. Aman. That was very thorough, very interesting, as you had promised. So yes, it was very nice. And now we will let Dr. Pradhuman to take over. I'll have to. Okay. Yes, Dr. Pradhuman, you should be able to start your video now. And all friends
I'm sorry for that 30-second break which happened all of a sudden. I don't know how.
No worries. We were entertained. Don't worry.
Oh, okay.
Okay.
Ma'am, I'm audible to all of you?
Yes.
Yeah. Yes. First, I want to give a big thanks to Dr. Aman. Dr. Aman, you have described the subject of forensic odontology in awesome way. So it's actually a boosting presentation for all those people who want, all the students, all the dentists who want to join forensic odontology as in the coming future. So, so many different things you have covered in a very short time. Even the important thing is that the experience, your own experience, that how you started from A and how you reached almost the level of Z. So it's always great to listen you. And regarding the questions, I don't think so there are much questions, and most of the things. Before I'll discuss any question on the Facebook, just there is one question from my side. If you Dr. Aman, if you don't feel, I want to have small words from you regarding your experience, your personal experience in Germany when you're doing your facial reconstruction training in Germany. How is your experience, and can you share the things with our audience?
Great. It is a experience which I would love to share. Why? I'll tell you. It was I got the permission to go to Germany from my university on 28th of 27th of February, I was supposed to reach Germany. I reached on 27th, and there was an outbreak of virus in the entire world. Entire world was on knees. Now, when I was seeing it, there were only 5 cases in Germany when I landed, and my training was going on. I was cut off from the world. I was totally 24/7 with Dr. Osgur. And when the training completed, I realized that I have to go to Milan and then go to Turin to Dr. Emilio, where I was supposed to give a lecture. And my brother calls up, you will not be able to come back. Just come back immediately. Wherever you find a flight, just come back. So if you ask me experience, that 7 days, 8 days, I was cut up from the world. And the technology which they were using was the tuck back, the tuck back. I could touch, with that pen, I could touch. I have been doing it on mouse. I've been doing the things on mouse, building up, rotating 3-dimensionally the face, building up maybe manually. But this was another level. The library which was there was seven floors down. It was just small, and I thought, it's a very pretty, suburbs. It looks like a village. There's not much skyscrapers. I thought, maybe this is outskirt. They won't be. I don't know how they manage so much of technology. When I went inside, I realized that a lot of things were happening. There was undercurrent. I will say that we have a lot of things. They have a lot of things to take from us, and we have a lot of things to take from them. Whether it is technology, we have a lot of data with us. They are amazed by the publications which happen in India. They are amazed. They feel that we are a hub for publication, and we have so much of data. And they do not have data because very scarcely populated, and where there is no disease, the doctors have very less to do actually.
Thank you so much, Dr. Aman. Thank you so much. It's really a great experience to listen all these things from your side. Actually, the forensic odontology is a growing or a budding branch in India, and day and day it's growing, achieving its heights. So even I am involved in different aspects of forensic odontology. You are just talking about the Veerapan. So that is the incidence that prompted me to go for that ear prints. So I have performed my study on the ear prints, and it's been published in an international journal. So it's you rightly said that people used to explore this branch properly so that they can do something. And yes, now it's a chance for the Dental Council of India to introduce it as a separate branch. So I'll be praying that hope we'll get this as a separate branch. And thank you once again for sharing all experiences. And hope many people they'll get benefit from this lecture. Thank you.
So I want to ask something from both of you. You have been both now involved, I think, in forensic for some time. So I think Aman is, I think Dr. Pradhuman for over 12 years, and I don't know how long you have been involved in forensic, Aman. But what do you feel? Has there been a change now? Is there a change in terms of, like you were saying earlier, obviously this is one of those branches that is not really, it's like right now, nobody's child and everybody's child.
Exactly.
Yes. So we are all at some point don't want to share, but at the same time, everybody needs everybody. So we have to begin to understand that that's required. But do you feel there is a change?
My first 2 years, I'll tell you, I thought, let me take it all to myself. The moment I started giving it to everybody, franchising, it bloomed. My science bloomed like anything. If I started taking help from Dr. Priyanka for orthodontics in this, getting a opinion, it changed my perception towards the bite mark analysis or the analysis of the facial profile or the proportions. They have a lot to offer, and most importantly, whether it is oral medicine or orthodontics, they have maximum data. Be friends with them, keep them happy. Otherwise, you will not have, you have your myopic vision as much you want. You will not be able to work much.
Actually, this is a comprehensive branch. We need the participation from every branch of dentistry. It's not that oral pathology or oral medicine nor orthodontist. So we want every specialist to come into it and work as per their expertise. Only then we can come up and prove that yes, forensic odontology is a very important subject in the dentistry. Nowadays, we are seeing that forensic sciences, it's a separate subject in the medical sciences. So now it's a time for the dentist. Now is the time for the Dental Council of India, we all to come up with the separate branch, and we'll introduce this thing as a part of the forensic total expert team. So forensic odontology now it's being considered as one of the forensic odontology is a part of the forensic team, and they should not be considered as an adjunct. They should be considered as an important aspect of the team. They should have their proper say, because nowadays mostly the people are depending upon the dentist first before going for the other vital ways through which we can come across. Thank you, Dr. Mandita, for your question.
That's nice. Let's see what anyone is saying there in YouTube. Yes, so we have also been joined afterwards by I think Dr. Meherangiz was there before, Dr. Mansoor Mati, Dr. Karpakavali, Dr. Arvind Babu has joined us. Hello, and yes, and Dr. Andi. Everyone is saying it was very nice.
Thank you.
And Dr. Priyanka is saying excellent presentation. Dr. Sneha is saying thank you, sir. It was great learning experience. Dr. Arvind is saying excellent job. Dr. Pooja, I think everybody more or less is telling you that it was an excellent job, which was, of course, goes without saying.
Sending questions personally, I guess.
Now, yeah, these are people who are probably going to ask you questions personally, yes. But it was, and we also have Dr. Sangeeta Palaskar with us, I think, who joined a little later. So we have had a lot of people. We have had a good number watching, about 200 playbacks, which is good in the middle of a working day. So you have reached the channel's regular number and a little above. You also got 23 likes while it was going on. So that's nice. And a lot more will watch it now after they finish work. So, yeah. Yes. And I really think, like earlier, I think you were just telling me about that oral pathology 360 is a little too oral pathology, but it is going beyond. And it is true. But yeah, I have to, I think, at some point clarify this. The thing is, that why I use oral pathology so much. Like I think I use the word about 4 or 5
just
times.
To add, ma'am, people get hurt. People get hurt when they see only oral pathology there. They say, I came to learn, and why should there be they don't understand that word 360 is added so that we have a turnaround in 360.
Yes. So now I'm going to just clarify 2 things in this. One is the 360. The reason this is 360 is to say that oral pathology in the 360 view is back to dentistry and back to pathology, actually, both of which are essentially stakeholders within oral pathology, and forward to the patients. So it is, or to the community. So it is 360 in that way, not just 360 around oral pathology, but 360 with oral pathology as a part of everything else. And which is why we even have a dentistry special section. But also there is a reason, and I wish to say this to everybody, at the end of every session, I ask people to subscribe, and they must be wondering why. I mean, this is not a channel that's ever going to reach a YouTube number that's going to earn anybody any money, or, make 1 million visits or anything of the kind. That's not the thing. The thing is, every time we use the word oral pathology, or you use oral medicine, or you use anything specific that we want to highlight, the algorithms begin to show it. If every day, and I would suggest that to you too, we do, we search 100 things in a day, we go to Google and keep hitting different things. Take 2 minutes to search for any dental topic, for any dental specialty, for oral medicine, for oral surgery, for oral pathology, or forensic odontology, whatever is your fascination. But basically, you are giving exposure to our subject. Today, still, if you put oral pathology, half the things that come up are speech therapists. And a professional setup like LinkedIn, when you go for jobs, has only oral surgery, has dentistry, and has only oral surgery. Where are the rest of us? Or at least it should have said dental specialist and put all of us there. I understand. But this is what I'm saying. Unless people know we exist, and in today's world, that is all through algorithms and digital search. You want to begin to matter, you have to start coming there, up there somewhere in the search. Sometime back, I was very happy that the channel had showed up and someone did a search for fibro-osseous lesions. A final year student in Egypt was looking for a topic for their coursework and found a video and got in touch with me to say, how can I cite it? Now, when we begin, it's got nothing, it's the finest. And I asked her, I said, normally, if you put anything, you will begin to get more pathology than oral pathology, even in all these things. So she said, no, it came because it was, and because it was a video, I decided to watch it. It's easier than reading. So this is why I keep going oral pathology, not because I don't care for the other branches or don't think that they are important. They are all important and we really need to be doing this together. But because there are less of us really searching for oral pathology, and I would suggest everybody search the same way in their own subjects, and that would, bring us up as a whole.
Divert traffic towards the topic,
yes.
and automatically the Google, who does not have only algorithms, nothing, they will start diverting more traffic. It is a vicious circle.
Yes. The more times we turn up in a search, the more time people search, then we will begin to matter in a way and we begin to make a difference. And also, the more times I use the word oral pathology somewhere, finally people are going to ask, what the hell is oral pathology? And that gives us a chance to explain, okay, this is what is oral pathology. That's the general idea. So in the same note, and yes, there is nothing more. Yes. So all I'm going to say now, normally, like I said, I would say, please subscribe to the channel if you haven't. Today, I'm going to say a little different thing. Dr. Aman has his own channel. Please visit it, find out what's there in it, subscribe if you like. And for full disclosure, he did not know I'm going to say this. So he's not asked me. I have just decided I like to promote what others do. It is finally a collective. And wherever we are in dentistry, wherever we can, we should support each other. Yes. So please go. You're already on YouTube. Take a little bypass, go to his channel. It's on his own name. You will find it easily and see the content. And definitely hit subscribe. So now, anything else any of you would want to say before I move on to sharing?
Thank you so much, ma'am. Thank you so much for giving us the opportunity to come on your channel and to discuss the things with you.
You're most welcome. My pleasure. So now just hang on for a second. Let me share your certificates. Are you seeing this?
Yes, ma'am. Yes.
Okay, thank you. Thank you so much, Dr. Aman. That was a very nice presentation and thank you for being here. And yes. Dr. Pradhuman, thank you. In fact, I think
my pleasure, ma'am.
Just 3 days back, we did not know each other. Now we know each other. This is
great.
Yeah. Yes. Thank you so much.
Thank you so much.
Thank you. And this is also where, yes, of course. And thank you all the viewers. I mean, without you, finally, this will not happen and it will just not be fun. Not as much fun. Without you all watching this live, it will not be as much fun. So it's lovely to have you all here. And yes, this is where we share next week's event. So the next one is by Dr. Sangeeta Paluskar, and it is on liquid biopsy, the current trends and future perspective. So I do hope, I have put a little marker there. So please don't forget, it is on coming Tuesday at 11 IST as usual. So with that, yes, and thank you everybody. Thank you for lovely comments on YouTube. Thank you all. With that, we shall say bye. See you all.
Okay, bye, ma'am.
Bye. Bye.
phone आ रहा तो फिर I'll be back. It's fine.